It's time for your Healthy Dose, your weekly capsule of health information. It's brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. We're talking about women's health, and we're going to outline some concerns and also talk about some events that are going to be taking place. And in our studio is Julie Reed. She is a radiological technician.
Technologist.
Technologist.
Good morning.
A techie. Good morning, Julie. How are you?
I'm good, thank you.
Excellent. National Women's Health Week is May 11th through May 17th, and you are going to be hosting a health fair coming up.
That's correct. We normally have 2 events every year to offer mammography and women's health services for working women, and we offer those in later hours. And this year we decided to expand upon that and have a women's health fair and have it from 1 in the afternoon till 7 at night so that everyone would have more access to time frames.
So this includes a myriad of services, little checks.
Yes, and we're very excited about this. We are going to have some blood pressure screening booths, stress management, diabetes care, heart health. Our chef is going to be fixing healthy food samples, yes, and giving out recipes. And one of the things we're really excited about is there's going to be health exercise demonstrations throughout the day. So if you get online and check which health exercise program you would like to attend, then you could correlate your mammography appointment with that. So it's just going to be a day of a lot of fun. We are going to have gift bags, drawings for gift bags, I said that, sorry, and discount coupons for Judy's Boutique, which is the gift shop at the hospital as well.
Oh, okay. So there's a lot of reasons why we should go, not only just the perks, but
right.
the issues that women face.
And it all really boils down to women taking care of themselves. And we've talked about this before. You know, women always are busy with jobs, family, taking care of everything at home, and just taking time out 20 minutes out of their schedule to get their mammogram done every year. And this gives them an opportunity to do that after work. You can even get home, get the kids supper, and then head down and get your mammogram, because we will be there till 7 o'clock.
I noticed, too, that on the list here you've got things like diabetes care, smoking cessation, skin care, and all that, too.
And it's just all of these are going to be boosts so that you can stop in and say that you do have a skin concern. You know, our dermatologist will be there to be able to talk to you about that. They're going to have skin care products. You know, it's getting tanning time. I'm sure they're going to talk to you about sunscreen and skin cancer prevention, and it's just going to be a time just to relax and have a good time, but ultimately to get your mammogram as well.
And make sure you're healthy and find out new ways of being healthier.
I'm really excited about seeing the chef and all of the healthy things that he's going to cook for us.
Absolutely.
Yeah, and that's the key. You know, proper diet, proper exercise is all part, and and healthy living. That's all part of it. Are you, Julie, and maybe you're not at liberty to answer this question, but is it safe to assume that it was always the women's role to kick the guys' derriere to get them to go
Correct.
see the doctor on a regular basis? Has that started to shift a little bit because of the women's schedule?
That's right. And I think that that's a national trend, and you're seeing it. You know, you can't hardly turn on the TV, newspaper, or anything, and it's health, health, health. And it's not just geared towards males or adolescents, either one. You can just see it's kind of come full circle. And I do believe that women's health, they know that they need to take care of themselves, and I think it's becoming more and more aware.
Don't you find, too, that a lot of women, in an attempt to what they think is be healthy, be unstressed, and control their weight and things like that, do take up smoking, and then they end up in a situation where that whole thought process of how to be healthy needs to be totally changed?
Yes, I agree. And I think that the more that you can put this boosts like these out for women, the more that it becomes public for them to be able to
Well, it's accessibility, I
Yes,
think, because
that's-
there's some intimidation, Julie, when I pick up the phone and say, "Yeah, is the doctor have some time to see me because blah 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 blah." This really it fits their schedule. They can come and go as they wish. The only thing that you ask is if they do come by for a mammogram to make an appointment for that.
Right, and we do need to talk about this number because it's very important. It's a direct line just for this Women's Health Fair.
Okay.
And that number is 573-406-1639. And this mammography screening is for anyone over the age of 40 not having any breast complications at all and who has not had a mammogram in the last year.
Would that serve as the baseline?
Yes.
Okay.
If they are 40 and have not had a mammogram and they are not having any complications, this would serve as their baseline.
Okay.
We'll be doing these mammograms every 15 minutes from 1 o'clock to 7 o'clock. So there will be adequate appointment times for you to grab your neighbor, your cousin, whoever, and come on down and enjoy our day.
Make it a girls' outing. Yeah.
Because after all, it's National Women's Health Week.
Well, and you do a couple women's events annually, right?
Correct. This takes place of our Ladies' Night Out in the spring, which we always coordinated with Mother's Day, around Mother's Day. And we tried to expand it this year and do the Women's Health Fair. And then in the fall, of course, October, we'll do our Ladies' Night Out events there again.
Okay. And all these events and more information, you've got a great website we can go to, an online calendar.
Yes, and it's hrhonline.org. And like I said, the exercise programs, they're going to have a timed list of which programs are going to be going on at what time. So that way you can coordinate your mammogram appointment with what exercise program you might want to go to as well.
Okay.
And you don't need a physician order for the
No,
mammogram.
as long as you are asymptomatic and you have not had one in a year and you're over the age of 40.
Is there a charge for any of this?
No, the mammography, that's the reason we do the number is they will take your insurance for that. But other than that, the whole entire health fair is free.
Good to know.
That's a great deal.
Let's say where the health fair will take place.
In Hannibal Regional Hospital in the main lobby of the hospital. And the phone number again is 573-406-1639.
All right. Don't forget National Women's Health Week, May 11th through May 17th. Recognizing women's health issues and really kind of having a lot of fun doing it.
Yep, that's correct.
All right. Good to know. Julie Reed, great information. Thank you very much.
Thank you.
Thank you.
That's your weekly capsule of health information. It is brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. More information at hrhonline.org or hannibalhealth.org.